Okay, think about this for a second. Your body's support system, the very skeleton that holds you up, what if it was secretly weakening day by day? This isn't some sci-fi movie plot. For millions of people, it's the reality of a condition called osteoporosis. Today, we're going to pull back the curtain on this silent threat and, more importantly, talk about what you can do about it. It's a pretty unsettling thought, isn't it? The idea that the very frame holding you together could be losing its strength, little by little, and you wouldn't even have a clue. That's the reality of osteoporosis, and really understanding it is the absolute first step to fighting back. All right, so to really get a handle on what's at stake, we need to look closer at what's going on inside our bones. What exactly makes this a silent disease? Let's dive in. So what are we actually talking about when we say osteoporosis? Well, imagine a healthy bone is like a really dense honeycomb structure. With osteoporosis, the holes in that honeycomb start getting bigger and bigger, making the whole thing weak and fragile. And that's why something as simple as a minor fall, or heck, even a powerful sneeze, could lead to a really serious fracture. You know, this doesn't just happen out of the blue. There are specific things that can really increase your risk. And what's kind of shocking is that for a lot of people, the very first sign is a bone fracture after they turn 50. So getting to know these risk factors is absolutely key for prevention and catching it early. Okay, let's just run through these. First up, aging and the hormonal shifts that come with it, especially post-menopause, are huge factors. If it runs in your family, that's another big one. Then you've got lifestyle stuff, not getting enough calcium and vitamin D, or just not being active enough. And yeah, certain medications or long-term illnesses can also play a part. As I'm talking, just kind of think about whether any of these might apply to you. Which, of course, leads to the big question, right? If this thing is so quiet and the risks are pretty clear, when are you actually supposed to get checked out? So the general rule of thumb is for women to get screened over the age of 50 and for men over 65. But, and this is super important, if you have any of those risk factors we just talked about, you really should chat with your doctor about getting screened even earlier. This is so crucial to understand because this disease is so sneaky in the beginning. The signs that you do eventually see are often late-stage warnings. This is basically your body's setting up a flare, letting you know that something is definitely wrong. I mean, a fracture from a fall that really shouldn't have been a big deal, that's a major red flag. But you also want to look for the more subtle things, like if you notice you're getting a bit shorter over time, or developing that classic stooped posture. Even chronic back pain can be a sign, sometimes caused by tiny fractures in your spine. These are not just normal parts of getting older, they're signals to go get checked out. Okay, so we've laid out the problem, we've talked about the risks, and it can all sound a little scary. But here's the good news, and it's really good news. You are not powerless here. It's all about shifting from just being aware to taking action. Let's get into the toolkit for building stronger bones. This lays out a super clear 4-step game plan. It all starts with getting a proper diagnosis, which is usually done with a simple and painless bone density test called a DEXA scan. From there, it's a mix of treatment, like medication and nutrition, strengthening your body with exercise, and finally, prevention, which means making your home and your environment safer. Now, let's zoom in on nutrition for a sec, because this is huge. It's about way more than just drinking milk. Think of it like this. Calcium is the bricks for your bones. Vitamin D is like the construction worker that helps your body actually use those bricks. And protein, that provides the whole structural framework. You absolutely need all three working together to keep your bones strong. And what about exercise? Oh man, the difference here is like night and day. Seriously, just sitting around actually speeds up bone loss, but being active, especially with weight-bearing exercises, does the complete opposite. It not only makes your bones and muscles stronger, but it also improves your balance, which directly cuts down your risk of taking a nasty fall. All right, this is the one everybody wants to know, right? The million-dollar question. Once the damage is done, can you actually turn back the clock? Well, the answer is a little complex, but it is definitely hopeful. While you can't totally reverse all the bone loss that's happened, jumping on a treatment plan makes a massive difference. It can seriously slow down the disease's progression, and this is the key part. It can significantly strengthen the bone you still have, making it much denser and way less likely to break. And that brings us to something that is just so practical, but absolutely critical. Since a simple fall can turn into a devastating fracture when you have osteoporosis, preventing that fall in the first place becomes one of the most important things you can do. It's pretty amazing when you think about it. Some of the simplest changes around the house can have the biggest impact. Little things like getting rid of throw rugs you could trip on, adding handrails to your stairs, making sure hallways are well lit, and even just wearing good supportive shoes inside. These are all things you can literally do today. All right, so as we start to pull all of this together, the real message here isn't one of fear. It's actually a message of empowerment. It's all about being proactive and taking steps to build a stronger and much safer future for yourself. So, if you remember just one thing, let it be this. Yes, osteoporosis weakens bones, but that is not the end of the story. Not by a long shot. With the right knowledge and proactive care, you can absolutely protect your health, you can maintain your independence, and you can keep on living a full, active, and safe life. And that just leaves me with one last question for you. After hearing all of this, from nutrition and exercise to making your home safer and getting screened, what is one small, doable step you're going to take for your bone health starting today?